In this video, we'll be looking at the thigh, hip, groin, and pelvis and the injuries that can occur there. The thigh muscles have incredible strength and endurance, which makes it hard for it to be strained, requiring an extreme stress to be needed to sustain a hamstring or quad strain. One of the most important factors in preventing strains of the thigh is by performing dynamic stretching. Having a regular strengthening program can help prevent thigh injuries as well. A quad contusion normally occurs from a hard blow to the quad or from multiple blows to the same area. Signs of injury is intense pain and temporary loss of function, with bruising presenting either right away or within the first 48 hours. Assessment is necessary to ensure that no internal bleeding is occurring. Pain management is needed in the first hours following the injury. However, isometrics need to start as soon as it's tolerated to prevent atrophy of the muscle. Treatment should also be performed to prevent myositis ossificans or calcification from occurring in the area. Quad strains are common when you fall on a bent knee or a sudden forceful contraction occurs. This can be due to a muscle weakness, especially if there is a muscle imbalance between the hamstrings and the quads. Spasms are very common to indicate that a tear has occurred. A deformity can also indicate a complete tear of the muscle. Hamstring strains that can occur and present acutely as if they were shot in the leg. This is demonstrated in the video where Stanton suffers a hamstring strain while running to first base. Lack of flexibility and fatigue are the leading causes of acute hamstring strains. Muscle imbalances and leg length discrepancies can cause chronic tearing as well. Locating the place of pain is important with the strain occurring in either the muscle belly or the tendon. The grades of injury are the same as in all muscle strains. Femur fractures are extremely uncommon in sport but can occur. It is mostly likely to occur in the middle one-third of the bone or at a point of contact. Loss of function, shock, and extreme pain are the most common signs of the injury. Deformity might not always be present depending on the thigh girth of the individual. Before transporting an athlete that has sustained a femur fracture, it is important to verify that no neurovascular structures appear to be compromised. Assessing for circulation and nerve pain is essential even while treating for shock. Groin strains are very common during preseason activity due to poor strength and flexibility. It is often due to overtraining in their sport activity. It can cause internal hemorrhaging, so individuals should be monitored or checked by a physician. Rest is the most important part of care for this injury. Hip dislocations are rare as well and occurs with extreme axial force on the femur. The individual will appear in a flexed, adducted, and internally rotated position. You can see this in the video of Cody Ross dislocating his hip on his run to first base. Like a fracture, neurological damage needs to be assessed and always follow the cardinal rule of dislocation. Assume a fracture if it is the first time dislocating. Hip labrum tears are common due to overuse or due to a dislocation. It can also be caused due to congenital deformities such as a cam lesion on the head of the femur. Limited range of motion can occur as well as hip stiffness. When assessing hip range of motion, clicking, locking, or catching can also occur. Hip pointers are commonly caused by a direct blow to the area. This can cause spasms of the surrounding soft tissue and cause decreased hip flexion and rotation on the trunk. X-rays should be taken with limited range of motion and in severe cases. Direct blows can cause acute fractures of the pelvis, which results in severe pain and loss of function. Shock is also common with this injury, therefore treating for shock and referring to a physician is necessary for further imaging.